Good morning. This talk is meant to give you some guidance on how you select the topic for, how you develop, and then how you present your ACGME required annual presentation. So here are the learning objectives of this talk. First of all, to be able to select appropriate topics considering the residency level that you're at and the presentation time that you have available. Design a presentation that focuses on the key learning objectives. Incorporate brain-friendly teaching methods into your presentation, and then finally identify ways to improve your oral presentation skills. So giving a presentation is an ACGME requirement. This is done differently at different institutions. At mine, Dartmouth Hitchcock, we expect the R1 and R2 residents to give a 30-minute presentation. We give the R3s a break because of boards, and then the R4 a 45-minute presentation. We ask them to be able to schedule with our program coordinator, who's Jill, by the end of August, and that they should only cancel and reschedule with good reason, because otherwise we find that the cancellations go on and on and on, and then suddenly we have 20 residents, all of whom need to present in June before the end of the year, and this doesn't work very well. Now, if you're at our institution, one of the three of us named here will evaluate your presentation. We have a standardized peer review format for this. And this is not meant to be any kind of punitive exercise. It's not scored. It doesn't go into your records. It is meant as a something that to really help you improve your next presentation. So it's a learning exercise. I give you the sheets at the end. I don't even keep them. I've forgotten about them by then. Time you do your next presentation. So picking the topic correctly right at the beginning is key to the whole presentation. And this is sort of a bit of a Goldilocks analogy here, but if you pick too small a topic, then you're not going to have enough information to be able to do for the whole of the assigned period. If you pick too big a topic, then you're going to be doing a very superficial and cursory review of it. So there's sort of somewhere in between, there's the amount that's just right. And again, this can depend on how much time you have to present and what R level you are. Generally speaking, a subtopic is going to work better. So, for example, talk about neurosarcoidosis, not sarcoidosis, which is a massive topic, and you'll only be able to cover very superficially in a 45-minute or 1-hour period. It's a good idea to have a look at our online curriculum to make sure that that wasn't given recently, because otherwise you're going to be head-to-head with a faculty member about the same topic. I know this sounds obvious, but we have had first years select topics which they haven't even rotated in, and that's you know, brave, but one could say a little foolhardy. Before you decide to start working up this topic, discuss that topic with a faculty member, preferably the Director of Education within the subsection, or come and talk to me about it. And we do expect that these talks are going to progress over the 4-year period, and that they should be of increased complexity with R level. That doesn't mean to say as an R1 that it's going to be okay to give a sort of basic medical student level talk. You should pick your faculty mentor for this depending on what the subject is. As I said before, review the topic with the faculty, draft the talk, and then have that reviewed by the faculty, and this should not be the night before the presentation. They're not going to be very happy, and you will be really unhappy if they have a lot of changes. So make sure this is a good week or even several weeks before you're going to give the talk, and then they should see a version of the final talk for help for you have some little tweaks before you present it. Now, you may have noticed I started my talk by giving learning objectives, and I'm going to spend a few slides here talking about why you need to start making your talk by developing your learning objectives. They should not be at the end. And this is all to do with whether something is learner-centric teaching, which means what do they need, in other words, your colleagues need to learn, not what do you want to teach them. It's not the same thing. We really have to focus on the learner here. So in other words, it's all about them, not all about you. Now, a teacher-centric method is the opposite. It's sort of, what should I teach? What will I cover during my lecture? How am I going to cover it? So you're sort of deciding ahead, not even thinking what they need to know. The learner-centric method is what should they know beforehand coming to the lecture, so you know where to start. What should they be able to do by the end of the session, and how are you going to get them there? So each of your learning objectives, and you write them, should focus on the learner, so what they're going to learn, not what you're going to teach. They provide you with a really important framework for developing the session. They provide you with guidance if you wish to evaluate them by giving them a little quiz. You don't have to evaluate them, but you should be able to evaluate your learning objectives. They force you to limit the content and not get too spread out. And also they're really important for the learners. They provide them with some guidance as to what they need to focus on and pick up from this session. And this has been shown to help long-term memorization. Now, I'm sure you've heard SMART be referred to in a number of different areas before, but basically it can be applied to learning objectives. So they should be specific, very clear. They should be measurable if you chose to measure whether somebody achieved them. They should be attainable in the time that you have available. So doing something that is sort of, you're going to talk about all of sarcoidosis in half an hour, that's not going to work. They should be relevant, so they should be important information for them to learn, and then targeted to the appropriate level of learning. So you're talking to residents here in your grand rounds, so while you want to have some, faculty there and faculty interest, these are not primarily directed at faculty. For any one teaching session, and whether you're talking a lecture or small group teaching or workshop here, you have a core objective. And I'm going to make this a little more clearer, some examples in a minute. And this core objective is supported by a number of smaller objectives. So to put it graphically, your core objective is your final destination, where you want your learners to be by the end of the session. And all the other supporting objectives are kind of how you get there, the little pieces of it. So here's an example. So the core objective is to appropriately manage patients in the prevention and treatment of adverse effects of iodinated contrast. But these are the separate learning objectives. So I'll let you just kind of read through these. It doesn't really matter, but to give you one example, understand the etiology and the consequences of the adverse effects of iodinated contrast. Now, one thing I want you to notice is that for each of these, there is an active verb at the beginning, and that active verb is something that the learner should be able to do by the end of the session, and if you wanted to, something that you could be able to test whether they knew how to do it. I'll just give you a few seconds to just read through those. So those active verbs that I pointed out identify the skills they should acquire. We use them, as I'll show you in a minute, to be able to distinguish between lower and higher order learning, and they lead to potential means of evaluation. Now, some of you may be familiar with Bloom's taxonomy, some may not. Bloom was a educational psychologist back in the 1950s, and he developed these ranks of learning objectives, with the lower area of this pyramid, like remember, being sort of, there's some importance to remembering stuff, but we really want to move on to higher level of learning objectives. We want to try and get people so that they can apply and analyze and evaluate content. And this transition here between just remembering stuff and being able to create is how you start to move from being a novice learner, like when you first come into radiology, to being an expert when you theoretically leave your residency, or certainly when you've gone through fellowship and into faculty positions. Now, if you Google Bloom's taxonomy, you're going to come up with a whole load of tables like this. And you'll see that for any one of these Bloom's levels, there's a whole load of verbs associated with it. And I use these all the time. So every time when I'm writing my lectures, and I'm writing my learning objectives for them, I'm going to pull up one of these tables and I'm going to start to think, how can I start to use some of these ones up here? It's okay to have a couple of the ones down here, but I want to include at least 2 or 3 higher level learning objectives in my talks. So, it can take me an hour to write good learning objectives for a brand new talk because you really have to think about them very carefully because this should be your first task. It's going to make the framework for what I'm going to do. They should focus on really important skills and knowledge that your learners must acquire. Generally speaking, you don't want more than 5 per session because you're not going to achieve that. Use those active verbs I showed you about. Include some higher Bloom's levels, and they should be testable. I didn't say that you have to test them. You don't have to do an exam at the end of your grand rounds, but they should be potentially testable or theoretically testable. So those of you who know me know that I'm really into doing brain-friendly teaching and teaching others how to do it. Now this is, I have a whole hour-long lecture on this, so this is a sort of summary part at the end of it. But I think it's really important you start to think right from the beginning on how can you make your didactic lectures brain-friendly. I'm not going to talk about the science behind it in this, I'm just going to talk about the kind of how do you do it. All right. So how do you make your lecture brain-friendly? Number 1, simplify the fonts, the colors, and the background. Boring is really good. You'll see that for virtually all my talks I have up on YouTube that, I have a sort of dark background and white or beige or white font. Really, really boring. I use a very simple font. I use a sans serif font, so it doesn't have the little tails on because it's easier to read, and I standardize it throughout. I have no icons in the corners, none of that stuff going on. Slide design is like men's pants. Memorability is really good. If you walk out of the talk remembering what their font was, remembering their slide design, remembering, that they got a little icons from the 6 different universities and organizations that were involved stuck in every corner, you are not remembering the content of the talk, and that's the important stuff. So it's kind of same like men's pants. If you remember a guy's pants, it's not often a good thing. If you're making the person in the audience really struggle to be able to read your slides because the font's too small or the colors are bad, they're not learning it. They're working hard on trying to read it. You want it to be very clear, very readable, and that's going to make it much more learnable. So a slide like this, which has, I don't know, 5 different fonts and 6 different colors, and then, there's kind of focusing on what are these little jumpy creatures? I don't know, are they angels? Chipmunk angels? Not sure. How do I get the cup? Do I get that for being really good? Whatever this is trying to convey, you're being really distracted by all the background stuff. There's a zillion fonts out there, but they're not going to improve your learning in any way whatsoever. Your brain adjusts very rapidly when you're watching a talk to what the font is, what the colors are, what the size is, and where the important information is displayed or highlighted. So every time you change and you flick between a different background just because you can't be bothered to sort of change it where you copied and pasted, the brain is having to sort of take a couple of seconds to readjust itself to the new format rather than a new color. So standardize everything as much as possible. Don't use capitals. Okay, capitalizing is like capitalizing in the email. It's interpreted as being shouting. And so while it might be sort of readable, and actually I would say it's less readable, it's quite difficult to read a lot of capitalized words. By the end of a talk that is entirely in capitals, you feel like someone's been yelling at you the whole time. Make the colors clear, make the contrast good. There are some colors that work really badly, like don't put red on blue. It may look good on your computer, but it often doesn't project. And you've got to remember that people's projection systems, as well as the light in the background of the room, vary hugely from place to place. So what can look fabulous on your really high resolution Mac may not look so good when it's presented. So keep a very high contrast between the font and the background. Please remember that a significant proportion of the audience are green, red colorblind, or it could even be blue, yellow colorblind, and that if you use those kind of combinations, if you had, say, green font on a red slide or vice versa, every slide will appear completely blank to them. Not very helpful. So this person here, and I can read this perfectly well on my computer, but I can tell you that it does not project very well, decided for whatever reason that they were going to use red on pink, and then the dreaded red on blue down here. This does not project well, and then they put a little icon of a who knows what in the corner just to distract you a little bit further. So you want to be very judicious with your use of animations. They can be very powerful, but they can also be extremely distracting. You can also avoid animations altogether by doing sequential slides. Now, this slide here contains something like 86 different animations. I can only imagine how long it took the faculty member who made this to do this, but I think we'll all agree it's pretty incomprehensible. Using things to identify an abnormality like this is a very good use of animations. Slide transitions, never use a slide transition. Slide transitions just need to be appear. There's some very cool ones out there. They're very tempting to use if you want to irritate the heck out of your audience, and I would recommend you use the one where your slide folds up like an origami bird and flies off the edge of the slide. Very funny the first time, not so funny the 36th time. So if you're going to use a slide transition, just use appear. That's my slide transition here. You've got to think about the font size, how it's going to be read from the back of the room. Okay, I use for wide display fonts a minimum of 32. If it's a conventional 4:3, then my standard font is 40 and I go down to 36. So using these little fonts doesn't help. If you are using that many words on your slide, split it into more slides and make the font larger. It's not the number of slides that count. It's the content on each slide. You know, what you have to remember is that when we make these talks, we're about 30 centimeters from our computer. But, you know, you're in the average lecture room looking something like this. And this is where all the residents sit, right at the back. So if you're going to show stuff, you need to make it very, very clear. This is from row 2 of the Ariel Lecture Theatre at RSNA, and as you can see, you can't read it from row 2. This lecture theatre holds 1,500 people, so the people at the back, no hope whatsoever. This, however, although one could argue with the fact that it is in capitals, which is annoying, is from the back row, and it's clearly readable by the entire audience. Think about how this is going to project. Are you going to have a dark background with light letters or a light background with dark letters? And I would argue that it really depends on whether you're going to be using images. Now, being a radiologist, generally speaking, your talks are going to have at least one image on. And so the darker you make the background, really the better for showing that. And what you really don't want to be doing is going from one to the other. So in a bright room, this is great. But in a darkened room, it's much better to have a dark background so that people's pupils can be maximally dilated. And as I said, you really want to be kind to their eyes. So what you don't want to be doing is going bright slide, bright side, dark side, because people's pupils are contracting and expanding, and that starts to get really painful, gives them eye strain, gives them a headache by the end of the session. And when they want to look at the images and they want their pupils maximally dilated, they're still contracted from the last bright slide. So just to show you the difference of how images appear now in on a white background, looking at this cardiac MR, it looks okay, but let's look at the difference with a dark background. See how much better that looks? Step number 2, make sure that you put each image and each graph on a separate slide in your presentation so that you can discuss that image, discuss that graph. Now, there are some exceptions to that. So you might want to put a pre and post contrast, CT or MRI, for example, or you might want to put a PA and a lateral chest x-ray together, but really minimize the number of images you have on the slide to those that have the key information. Otherwise, whichever image you're talking about, whatever graph you're talking about, a significant proportion of the audience are looking at the other ones. So putting up an image like this with 4 different graphs is nowhere near as effective as if you can split those up onto different slides. Now here's a really simple bar chart here, and I've done a couple of things here. One, I've made it very clear. I don't think anyone would miss anything. But also what I've done is I've color-coded it. And I know it's stereotypic, but you're more likely to remember it than if I'd, say, done those colors the other way around. don't waste your screen real estate here, okay? You know, mag the images up. I mean, none of this stuff is being used. Plus, you know, if our interest is down here, then why do we have to have all this other stuff here? You know, zoom up images to focus on the area of abnormality. So much better to give them a zoomed image here, and in this case, we've also added an arrow to point out the nice appendicitis with the appendicolith. Step 3, summarize tables. It's very tempting to just copy and paste a table from a paper, for example, and just stick it in there. But it invariably has way too much information. It's always really small. It's really unreadable. If you find that you are apologizing because people can't read something on your slide, that slide should not be in there. So don't even think about it. Take out the key information, put it into a little table in PowerPoint itself. It's very easy to do. And highlight the areas you really want people to focus on. A presentation is not the same as submitting a paper. It does not have to have all the data in there. So this is the kind of thing that we get presented by our institution for the Strategic Operations Plan. We've seen this presented in many talks, and it is completely unreadable. Nobody's ever going to be able to look at that in a presentation and work out what on earth it's all about. You know, even this table, which is not that bad, and it's been made in PowerPoint, but there's a lot of information in here when you're trying to present this in a very short period of time. So why not focus down onto a little bit more key information? And here, where we've just pulled out the important information that people really need to be focusing on, and not only that, but we've highlighted the significant results by making them in red to really bring their eyes to that. Step 4, and this really is important, and this is going to be helped by you increasing your font size, is remove as much as possible an awful lot of the text. Okay, this is not a book. You can use your speaker notes to remind you what you need to be saying. These are supposed to be the key points, the highlighted points that people are looking at and need to remember. So not only is the amount of text that's on there, and you'll be amazed how much you can pre-see it, but the amount of text that you put on every slide. So if you find that you're running over sort of about 6 lines, you probably need to be going on to a second slide and dividing that information up. Doesn't matter the number of slides, it's the amount of information that you're trying to deliver. So don't use this as speaker notes. Don't put every word you're going to be saying. People will be bored to death. They might as well just have a PowerPoint in advance. Put that stuff in your speaker notes and put the key points on your slide. So here is a slide from the medical school. Okay, you know, this is not readable. It's not memorable. What we need to do is pull out the key information from it. And this is the key information that needed to be conveyed from that one slide. So as I said before, if you force yourself to use larger font, you're going to force yourself to limit text. If you're starting to run into 2 lines, look at the text and see if you can make it just 1 line per bullet point. If you make sure that you consolidate information together such that you only have 1 learning point per slide. I'm not saying 1 line or 1 word or anything like that, but the information on any one slide just relates to any one little subtopic, one small learning point. You're going to help your audience remember that information. You're going to help them recall that information. So, you know, just to take your example, this is not a very complicated looking slide, you know, medical student type of slide on subdural and epidural hematomas. You know, we could be pretty happy about this, but when you start to look at it, it actually contains a number of different learning points. We're talking about mass effect, we're talking about how blood changes with time, we're talking about subdurals, we're talking about epidurals. So we can split this up. So we can have a slide where we can just talk about the mass effect and really get them to focus on that and the signs of mass effect. We can have a slide that illustrates how blood changes with time and really get them to focus on that, and we can reiterate the point of the mass effect if we want. And then we can talk about subdurals and show them a number of different examples, but notice the information is together there with the image. They don't have to remember it. And then finally talking about epidurals. What you're doing here is what's called chunking information. And chunking information is a very important way that we collate information together that's not only going to help us learn it better, but more importantly, it's going to help us retrieve it better together. Step number 6, remove as many abbreviations and acronyms as possible unless they're very common. You know, you're talking often to first-year residents in the audience, and while some, weird neurological abbreviation may be very obvious to you as a fourth-year resident, it's not to them. So unless you have to have them in, take them out. I mean, CHF and PE and CT, fine. I mean, how many people do you think in this audience, even though this was a CME lecture, were totally familiar with each of these abbreviations? And if somebody's sitting there trying to work an abbreviation out, they're not learning. And for junior learners, they're not going to really be willing to put their hand up and ask you what that abbreviation stands for. Signal the key information. Now, you can signal verbally, and there are verbal ways of signal, such as, if you don't remember anything else, then remember this. Your patients will die if you miss this. This is a very common abnormality that you need to know about. Or you can do it sometimes just by raising the volume of your voice. By signaling this information, you're going to improve the retention of the important stuff, and you're going to decrease the cognitive load on the learners, because they're going to be able to take notes much more effectively, because you're going to say, remember this, not just write down everything I've said on the last slide. Here's just a quick example from the literature. So they had 2 lectures, lecture where the speaker signaled key information and one where they didn't signal them. And they had groups of students who took notes, groups of students who didn't take notes. And what's interesting here, if you look at the unsignaled lecture, those students who did not take notes actually did better in their test scores afterwards than the ones that did. But when you signal the key information so that these poor note takers were not just trying to transcribe everything and they were already 3 slides behind, they did better. Just another example of how you can signal information by highlighting it on your slide. So not only by verbally, you can highlight the key information on a slide or a table by just putting it into a different font color. Images are infinitely more memorable than are words. So whenever you can replace some text with some images, and the more memorable those images are, the better, then do that. I'm kind of preaching to the choir as radiologists, but you'd be amazed where often there's a lot of text where just an image and a description of that image would do much better. So if I'm talking about inflammatory breast cancer, then having a picture like this where I can describe the per d'orange, I can show how it's enlarged, how it's inflamed, is going to be much more memorable, and adds, just having a list of those things adds absolutely nothing. Now, it is really, really important that you practice your talks. It is extremely obvious to me, having reviewed many a resident presentation, which residents finish their talks the night before and haven't practiced them, and which finish them a week before and they have practiced them. I'm a very experienced lecturer, but I practice any new talk multiple times. Okay, so if I do that, then you guys should be doing that even more. If I'm presenting an abstract at a national conference, I'll probably verbally go through it, 10 or 15 times before I stand up on stage. Even more sometimes for something like a mini TED talk. So practice verbally, talk to your dog, practice on your kids. My kids, of course, won't listen to my talks. Just talk to a chair. It doesn't really matter, but you have to do it verbally. If you just do it in your head, it's not the same thing. So I'm just going to finish by talking about a few things about presentation skills, so your verbal presentation skills. And, starting with number 1, 2, and 3, rehearse, rehearse, rehearse. If you're a nervous speaker, or you haven't had a lot of practice, you're going to be a lot more comfortable having run through this talk several times, so that it's, pretty much coming straight from memory rather than having to kind of think about things. Know your material. Make sure you know what's on your slide, so that you don't have to keep looking at it and trying to work out what this image showed. Have speaker notes, which you can use in PowerPoint and put things in presentation mode, but they should be aid memoirs. You shouldn't be reading them off that or reading off flashcards, because you know your material. All of these are going to help you do things like have a frequent eye contact with the audience. Don't pick on any one individual, because if every time you look up, you look at this one individual, you're going to start to feel really uncomfortable by the end of your presentation. So make eye contact with different areas of the audience. Modulate your voice. If you're just reading off your speaker notes, you're going to start to sound very monotone. So making sure that there's ups and downs in the tones of your voice. Keep engaging the audience wherever you can. So, ask questions of them, have them take cases. Make sure they understand what you just said. If you explain something complex, you can ask them, was that clear to you? Do you need me to explain a little bit more? Or if you're feeling a little braver, you could ask perhaps a resident to just summarize it back to you. Here's some brief speaking no-nos. Mumbling while you're talking to your speaker notes in a very quiet voice is going to be very irritating. Reading the slides, that means that you've put too much on the slides. Your audience can read. If you're just going to read your slides, then you might as well just send them out and tell them to go have a cup of coffee and read your slides. Be very careful with the laser pointer or with the LCD screens, which don't reflect laser pointers, thank God, or the mouse in that case. You don't want to be doing what I call sing along with Elmo, where you start to underline every sentence as you're saying it like this. It becomes extremely irritating. We all know that you read from top to bottom and left to right. We don't need to be shown that. Thank you very much. When you have an image that's up, and you're talking about the abnormality, you need to identify that abnormality. I know I don't have an abnormality here because I don't have an image here, but you need to identify that, because just, saying there was high T2 signal shown in the amygdala, there's going to be a bunch of your audience who have no clue where the amygdala is, or they certainly can't find it fast enough as you're describing it. So that's when you get your laser pointer or your mouse out and you identify it. If you don't want to do it like that, then I would suggest you have two slides, one after the other. One slide without any identification, and then you have a slide after it that has an arrow or circle or something that identifies the abnormality that you can go to. And that's often an easier way of doing that than sort of trying to get the mouse going and, because it goes to sleep, and then get your arrow coming up and then hoping people can see your arrow. So, a slide with just the image, let people look at it, and then you can have a slide that has it identified. And then, no audience interaction whatsoever is really boring. So, just try and engage the audience a little bit, have them take a little bit of a case. You don't even have to have them sit there while they take a full case. You could just, ask Jane to, please tell me where you think the abnormality is, or what type of sequence this is, or after you've described it, have Jane come up with the differential diagnosis, and so on. And then finally, what about the summary slides? Okay, we all put a little summary at the end, and unfortunately, most of these summaries are not what they should be. So a summary of the summary. The summary should not be a repeat of all the learning objectives. Okay, those were learning objectives. Now should be a summary of the information. It should not be a repeat of the outline of the talk. People often use an outline of the talk in place of learning objectives. It should be the key learning points in the talk. What thoughts do you want them to walk out with? If they only remembered 5 things from this talk, what 5 things do you want them to walk out with? So this is my summary. Careful topic selection is the key to success. Develop your learning objectives before you write the talk, and that less may often be more. You need to focus on the key content, you need to simplify the format, and you need to limit the amount of text that you have on the slide. You should review your talk at least 3 times with faculty, so that's going to be when you decide your topic, when you have your first draft and then your final draft. And then rehearse it multiple times, okay? Just one run through is not going to do it, and you need to have verbal run through. And then finally, relax and engage the audience, okay? So, try and have fun. These are your peers. This is not, you are not presenting these at the Ariel Lecture Theatre in front of 1,500 people. This is in front of your residents and a few faculty, so relax a little bit. my contact if anyone has any questions. Thank you for listening.